All right, let's speak more about this. Professor Helen Rees is the Executive Director at the WITS Reproductive Health and HIV Institute. She also happens to co-chair the Health Department's Mpox Incident Management Team and joins us now via our video link. Prof, great to see you as always. Thanks very much indeed for making time to help us better understand these issues. And I say that because many people are going through a moment of deja vu, if you like. You know, this virus this disease we're not really sure about. The WHO is now speaking up against it. We know that it can lead to deaths, but not in many instances. How concerned are you about just the trajectory of this disease and how the world is responding to it at what seems to be a fairly early stage?
Well, I think we learned that you shouldn't leave these things till too late from COVID. I mean, the earlier you actually look at something that is a potential pandemic threat and then respond, the better. Both the African CDC and the World Health Organization have declared a public health emergency for both the region and for the world. Now, in terms of how, is it similar? Is it different to COVID? COVID was spread, it's what we call a respiratory infection. So it's spread in the air when we breathe, when we cough, when we sneeze. And that makes it highly infectious. And we're particularly worried about viruses like that in terms of pandemics. Mpox is different. It's spread through contact. You've probably seen some photographs where there are lesions on the skin which are filled with fluid. And that fluid and those lesions, they can be in the mouth, they can be on the face, they can be, if it's sexually transmitted in the anal genital region, it can be extensively across the body, but you might just have a few of them. They are infectious. And so you can get Mpox through contact in that way. You can get it through sexual contact as well. But this is mostly contact. It can also happen if you are somebody who's a healthcare worker changing sheets and things like this, but that's less frequent. What we're really worried about is contact. So contact is not as easily spread as respiratory. However, what we are now seeing, as you said in your earlier interview, is that the virus is changing in its behavior. It didn't used to be spread through sexual contact, and now we're seeing sexual contact quite extensively, including in the big global outbreak that we had a couple of years ago. So we are worried about it. And what we want to do is to contain it now and not allow it to become really a rampant global problem. It's already a significant African problem.
Yeah. With COVID, we started speaking about how the virus was changing and mutating. In this case, we're also talking about variants insofar as Mpox is concerned. Help us better understand that, because it seems one mutation of this is causing a whole lot more concern than the other.
That's right. We first identified Mpox in the African region back in the 1970s. So it has been around for, 50 years. And unfortunately, the world didn't pay enough attention to the science and supporting researchers in the African region to actually understand this better. What we've seen now, instead of what we were seeing originally, which was that the virus would jump from an animal reservoir particularly into a household, would spread through contact within a household, and then could be contained. The virus has changed in its behavior, particularly what we've seen in the DRC, and we've seen that it's now being also sexually transmitted, particularly vulnerable, obviously, people who are having a lot of sexual partners. So that didn't happen before. So the virus has changed, and we call this 1B. And it's the 1B virus that people are extremely concerned about. In South Africa, we've got an outbreak that we call 2B, which is the same as the big global outbreak that occurred 2 years ago, where over 100 countries were affected. And that appears to be sexually transmitted as well as through contact. So we are seeing these changes, person-to-person contact, sexual contact. All of those things are now we're seeing a spread, and that is attached to this change in the behavior of the virus.
Yeah. When the initial discussions were starting around Mpox, specifically in the DRC, there was talks around specific vulnerable groups. With COVID-19, we spoke about people with comorbidities, for example, who need to be on the lookout. You've really emphasized how there's much more of a spread through sexual contact now than there was before. And I suppose that's what the vulnerable group then becomes.
Well, exactly. That's something that it's very important to build into our communication strategy. So what we're seeing now is certainly in vulnerable groups, we're seeing it, the 2022 outbreak and the current outbreak we've got in South Africa is amongst gay and bisexual men predominantly. But obviously, if somebody has got lesions and in a household, it can spread within a household as well. But we are trying to send messages out there, just like we did for HIV, and say, you know, if you are sexually active and you are in a high risk group for Mpox, be very careful, just as we said for HIV. If you have any lesions at all, if you start to feel unwell, present early to a clinic, because the earlier you present, the better we can both stop transmission onwards from somebody who's got Mpox, but also we can give guidance on treatment and management. And we are particularly worried about people living with HIV who are not well controlled. Many people in this country are well controlled on antiretrovirals. Their immune system has become strong again, and they can fight off viruses just as people without HIV can. But we are worried about that. We know there are many, many people who have either stopped their antiretrovirals or don't know that they're HIV positive. And that's when your immune system is weak. And that's what we worry about, because in those instances, you can get severe disease. And it's in those kinds of instances that we're seeing deaths in our current outbreak in South Africa.
Sure. I imagine a lot of people are wondering, Prof, what it is about the sexual activity of gay and bisexual men that makes them vulnerable. And I ask this question without, of course, hoping that we're not going to be gratuitous in the detail, but in terms of people just understanding what it is that makes them vulnerable. How would you explain that?
Well, it's not only gay. I mean, we're saying in South Africa and in the big global outbreak, it was predominantly in gay and bisexual men. But in the DRC, we're seeing heterosexual spread as well. And the bottom line is that, of course, sex is a very intimate behavior in many ways. You know, bodies, other areas, in many ways, it's a very, very intimate behavior. And so if you have something that is spread through contact, you're very vulnerable through sex. And so what we're saying to everybody is, particularly people who have a lot of sexual partners, please be very careful. Be on the lookout. If you see a lesion that looks a bit like a chickenpox lesion, if you're feeling lousy and you feel flu-like and feverish, go and present. But also be careful with your contacts. If anybody has a skin rash that you're not sure about, you know, you need to be very careful. What we're trying to do in the national response and globally is to stop transmission onwards. If we have a case, if we can isolate that case, we're not going to get this spill out. If we don't encourage people to come forward, come to clinics, train the healthcare workers to identify this, have the lab backup ready and available, we've got all of that going on now in South Africa. If we don't have that, then of course somebody will have this, not recognize the rash, and this is how you get spread. And this is how outbreaks get larger and larger, and this is what we're trying to avoid.
Fair enough. Clear and lucid as always. Professor Helen Rees, appreciate your time. Thanks very much indeed for helping us break down what sometimes is a very complex discussion. Professor Rees is the Executive Director at the Wits Reproductive Health and HIV Institute, also happens to co-chair the Health Department's Mpox Incident Management Team. Prof, once again, thanks for your time.